Hi, welcome to GBIA Mexico live patient surgery program. In this series, I would like to show you some tips about why we use piezoelectric surgery device. So, ultrasonic piezoelectric surgery device, why do we have to use it? Well, mainly we want to find the most efficient way to handle bone. Therefore, in a private practice, profitability relates directly to how efficient and quickly you can get things done. But at the end of the day, we want the bone biology for the patient to be at the optimal, for the maximum amount of comfort and healing, and so on. There are many products like the piezoelectric bone surgery products out there. And just for the technicality, this is called piezoelectric bone surgery device. Now, piezo surgery, as you see in this slide, is a trademark name from the original manufacturer's Mectron. But this technology, you see in histology when a rotary burr cuts the bone, it shows the histology to show acute inflammation, even some bone that is dead or burnt. SAW is another reciprocating vibration type of device that's commonly used, and it too also has some burning of the tissue, some heat generation, and therefore it translates to acute inflammation. When it comes to piezoelectric bone surgery device, because of the rather fast ultrasonic nature of the frequency and minimal amount of movement of the tip relative to the bone tissue, we tend to get as minimal amount of inflammation as possible. So that is the reason why we advocate the use. Well, where can we use it in the clinics? There are mainly four areas. It is a bone cutting device. Therefore, number one, of course, is the osseous. Number two, in relations to that, we can use surgical orthodontics. Not that we're going to be doing that in the Mexico program. We're going to do number three and number four, mainly the implant osteotomy and the sinus lift. So osseous procedures. As a periodontist, this is typically what we do. We cut bone, we shape bone, we plaster the bone, and in doing so, we can use a variety of different rotary instruments. Sometimes they have some advantages, but clearly piezoelectric surgery offers some of the things that others may not be able to. The versatility of different shapes. More commonly, even in implant dentistry, we do want to reduce or reshape bone that is not exactly what we want for physiological architecture, such as bone that protrudes out extremely. This is a good example. Mandibular tori, palatal tori, sometimes even in the buccal area, we see tori that needs to be taken away. Rotary burrs in very restricted areas such as the lingual floor of the mouth could be dangerous because the burr can wrap into the tissue and cause more trauma. So saw tips or certain types of particular tips that can go into tight space and reduce the bone and get out of there is a very, very efficient way of using this device. Another example is a furcation area that we may have to. Let's say you're placing an implant right next to this furcation defect. You do want to round off the edges. You want to be able to instrument that, and sometimes rotary burrs have its limits. So piezoelectric surgery tips with aggressively cutting end can actually do very, very good job in this type of situation. More commonly, we do bone block types of procedures. Here's a lady who used to be wearing a partial denture. Now she is in to get some implant reconstruction. A very limited amount of bone in terms of height and the width. So what do? We're going to be doing a significant procedure where we open up the angle of the mandible, the ascending ramus, and we basically want to do a block onlay type of graft. And here is the ascending ramus of the same patient. And look at how clean the cut is. Earlier on, before the advent of these types of devices, we used to use rotary, namely rotary burrs. And the thinnest burr you can actually get in, the cross-cut fissure type that you can go in and cut this, would be at least 1.5 to 2 times wide of the bone cut. So you're wasting a lot of the valuable bone, but at the same time, you're introducing a lot more trauma. So piezoelectric surgery solves that kind of problem. And here is the tip that we like, my favorite. We use it in this program because of many good reasons. Because Dr. Son, who invented this tip design, used to be our co-director of this program. So Son tip, take a look on the screen here. It has a cutting blade not only in the most advanced surface, but in front and back. Whereas others can only force you to go in one dimension, this allows you to go 1, 2, and 3 different types of directions, so the efficiency of cutting is quite there. Many times when we do this, we are restricted in the surgical space, so having versatility in the tips like this is a tremendous plus. Some of these variants of the tips with this 98-degree angle may also help in certain types of situations. So as you can see here, a very clean cut of the bone utilizing the maximum potential of piezoelectric surgery bone device is shown here, and the case can be moved on. We'll talk more about GBR at the end of the course, but this is a classic example of decoagulation to allow progenitor cells to move into the area, secure fastening using GBR screws to minimize micro movements, yet another facet of some of the cardinal features of GBR, and then primary closure and blood supply and so forth to the point where we can actually get the height and the width that we want, and eventually later on we go in, remove the screws, place the implants in the appropriate sites, and be able to move on even to some keratinized tissue augmentation where there's quite limited amount of gingiva. We go to the roof of the mouth, all in the same day, same surgery, be able to do that. And in a different section we'll talk about the use of concentrated growth factors, CGF. But CGF can be used in this type of situation very commonly to be able to dress the wound that's otherwise quite uncomfortable. Yet another example of piezoelectric surgery device that we can use very readily. Here is a failing implant case where 2 of the 4 implants are not doing very well. So ultimately we had to remove those implants. And because of the limited bone height, what I'm doing here is some of the more daring procedures that we do in clinical dentistry, taking the nerve content of the intra-IA infra-alveolar bundle and moving that out of the way, what's known as the nerve repositioning. To be able to do procedures like this, you need extreme detail, precision, and rotary burrs do have clearly some limits there, not to mention provoking inflammation because of the rotary device. So piezoelectric surgery has its place in being able to move the nerve, place the implants in the appropriate position, and to be able to move on, which otherwise would not have been possible. PAOO is a surgical procedure in orthodontics that is very commonly used in contemporary era. Here's a case where we are moving the blocks of the teeth, including the bone, to be able to move them into the right position using the surgical device. Now, earlier on, we used to do this with rotary. Again, myself, I used to use rotary. But now that we have this technology, we merged the so-called orthodontics, also known as PAOO, periodontally accelerated osteogenic orthodontics, to be able to do the procedure. Here's the originated Tom Wilco in this photograph. We're able to cut the bone in precise manner without necessarily damaging the nerve tissue, damaging the root structure,